Hi, thanks for jumping on Rehab and Revive's channel to address your spinal fusion recovery. So, unfortunately, you needed a spinal fusion. What do you do about the recovery? You needed it probably because there was faulty motions that created instabilities at that joint, which further broke down. Sometimes they break down so much there's a shift in your spine and you need to get pulled back. Sometimes the breakdown is so much you also get nerve symptoms like numbness and tingling or weakness or tripping over yourself that also need to be taken into account and then fused so you're not grinding away further and angering those nerves. So whatever the reason, our goal is to help you improve that mobility and prevent future fusions. You can read up on Google that if you have one fusion, usually 5-10 years later, there's another one above or below that segment. So let's do our very best to address that. And that's our thought process. We want to go about it at Rehab and Revive by surrounding the infrastructure of that fusion with the right exercises to stabilize the muscles. Then around that, the rib cage sometimes is necessary to address, as well as learning and addressing the pelvis, learning different habits to pivot and move and bend so you're not stressing those same joints out, because ultimately the stress needs to be dispersed somewhere else. So we need to go about it and address it the correct way so you don't have to have another fusion in the future. That's our goal for you. So remember, at Rehab and Revive, we heal smarter, not harder.